So again, I'm pleased to introduce our guest speaker today. We have Barbara Grice. Barbara works with the South Carolina Department of Health and Environmental Control as the Director of Community Engagement and the Healthy South Carolina Initiative. Barbara has over 20 years of experience as a public health practitioner in clinic and community-based services. She has been actively involved in the community engagement process, both at the local and state levels, and served as the NACCHO MAP Work Group Chairperson in 2009. She's currently working with state and local partners to implement the Healthy South Carolina Initiative Community Engagement Toolkit across South Carolina. Let's go ahead and please welcome Barbara Grice. Barbara?
Well, hello, everyone. I'm really happy to be with you today and discussing the action cycle. Today we're going to take a walkthrough of the action cycle, and I'm going to be using the Tri-County Connect Network as an example. The action cycle links three activities: planning, implementation, and evaluation. Planning looks at planning organized for action, develop realistic and measurable objectives, and develop action plans. Implementation, review the action plan for opportunities, and then implementation to monitor the progress, evaluation, prepare for evaluation, and focus on the evaluation design. The action cycle serves as a mini roadmap to guide community actions. Each one of the activities builds on each other and is in a very interactive manner. Remember, this is not the end of the process. The action cycle begins to produce results and shows implementation of the actions at the community level. This can be one of the most difficult phases of the community engagement process. The next slide kind of gives you the background and history of the community that we're looking at, and it includes the Tri-County Network area, which serves Bamberg, Calhoun, and Orangeburg counties. And you have information on the population, the poverty level, and the median household income. And the next slide looks at the leading causes of death. These are examples that were part of the comprehensive assessment report that is available on the Regional Medical Center's website. And the first community action cycle really looked at the presentation of this data and had focused conversations to begin to determine some of the priorities that they wanted to look at. The next slide looks at the questions that the network answered, what will be done to realize the community's vision, what we will do about it, how it will be done, and how we will know if we need or have made improvements, and how we will continually improve. The next slide kind of gives the information about the community and the Tri-County Network, the vision that they came up with, which is building collaborative partnerships to improve health in the Tri-County area. The mission, all partners will collectively work to educate, share, coordinate, and create individual systems change, and the values that they're looking at, demonstrating integrity, accountability, transparency, promoting teamwork and collaboration, embracing diversity, and respecting organizational tradition while encouraging innovation. The next thing they kind of looked at was beginning to organize questions. The steering committee asked questions. They really wanted to know, are the right people included in the action cycle? Who are they? And what are those local groups that should be included? What role will they play? What really can be pulled from folks in the expertise in the community, and are they at the table? Then potentially what kind of subcommittees or work groups should be convened to make things happen, and how will they ensure accountability for planning, implementation, and evaluation of the action plans. Coordination, one of the important questions that they ask, and you need to keep asking throughout the action cycle, are the right people included? That's something that they continually ask at every meeting. Some of the local partners that are included are the hospital, the health department, the federally funded clinic, the schools, work sites, churches, city and county government, local health organizations, local universities, and private health care providers, and other community-based groups. They asked when they were kind of looking at those partners and begin to think about what would implementation look like and what would accountability look like, and how would those partners be engaged and involved, and who could they link to. Coordination is key to preparation and making the plan come alive. Everyone needs to be rowing in the same direction and staying on course, and sometimes that is much more difficult to do than we think, because it takes a lot of time and effort and work to pull people together and get them moving in the same direction. The next piece looks at getting started. This gives you a little bit of background. The Tri-County Health Network began its community action planning efforts by conducting their health assessment, and that took place in 2012 and 13. Through this process, the partners gained a better understanding of the community perceptions about health and the quality of life. This provides useful information for the development of the Community Health Improvement Plan and their action plan.
All right. Well, thank you, Barbara. We're going to move over to our chat box here. And the question is, what groups of individuals or organizations typically get overlooked when putting a collaborative or work group together? Why do you think they get forgotten or ignored? So for all of our participants, if you want to go ahead and insert your response in the chat box, please go ahead. We have one response already. It says, community representatives or patients often get overlooked. Doctors think they have all the answers and don't need patient perspective. Okay, so we'll give about a minute or two here. So go ahead and please insert your responses in the chat box.
And Barbara, while that's going on, while people are putting their answers, do you want to help define tokenism for the group?
Sure. We've had a lot of discussions at the community level, and sometimes you will see certain folks are included at the table to represent a particular population or group, and they're sometimes considered to be a token member of that group, and they have broad representation of those folks in the community. So that is one of the things that we really caution in looking at how people are represented in the community and that they truly have a voice at the table.
Great. Thank you, Barbara. And it looks like we have a couple people answering right now. So we have someone that also said, let's see, geographical neighbors to the site. Youth are often overlooked when putting together work groups.
And Barbara, do you want to give any insight to these answers before we move on?
I think it would be great to get a little input maybe from the folks that are participating, because there are a lot of people that are involved in the process, and perhaps they'd like to share the reasons for what they selected.
Great. So anyone who's already responded, if you want to go ahead and raise your hand at the top of the screen, there's a little guy with the hand raised. Go ahead so we can call on you to unmute your phone and share your comments with us. And I see we also have a couple more comments here. Stakeholders can get overlooked, and persons with disabilities.
And I'll go first. This is Holly. I've worked a lot with physician groups and a lot of collaboratives and working on healthcare, and it seems to me sometimes that the work group, they may have the physician at the table, nurse practitioner, they may have all the medical providers, but it seems that the patient is sometimes missing at the table, and I think if they had that patient at the table, they would remember why they're even doing the work that they're doing, and having the patient there really keeps the group grounded on their mission and what they're moving forward with. So it's a win-win for both groups.
Great. Thank you, Holly. And let's see what other comments we have here. The specific group they are helping usually are overlooked in the planning phase. For example, low academic students, pregnant teens, individuals who have overcome obesity. Maybe it's easier to work with people in your profession. Very true. So, all right, if there are no more questions or answers, did anybody else want to share? Okay, don't see any hands raised, so we're going to go ahead to our next slide. And Barbara, if you want to continue with the presentation.
So we're looking at the action planning piece. This really helped us to determine specific activities, who was going to implement, and the time frame and the needed resources. And the group spent a lot of time talking about this because they really wanted to define what it was that they wanted to accomplish in their community, and they also needed to look at who was going to implement that, and that's a key piece of it. And there was a lot of discussion that it's a lot of the same people that are always at the table, and it's just a few key people who actually implement and do. So they had discussion about how they could engage others that aren't normally included in the process and get them to the table to help be part of that implementation piece. Also looking at realistic time frames and how they could set out their strategies to be able to accomplish those things within the given time frame that they were looking at, and then the needed resources to support those activities, what organizations could bring to the table, how that would look, where it would fit into the plan, and then ultimately how they would take ownership of that and take it to the next phase. This is looking at determining the priorities within the work group. So the work group really continued their journey to look at the priorities in the community, again, going back to the assessment that had been done, and really let that drive the conversation that they had. They were looking at the top health concerns and looking at the voice of the community to really see what the community was saying or the issues or concerns that they identified. They next looked at the main health issues and what was facing the community, what some of the leading health indicators say, and then what some of the policies or things that were in place to support that, and then potentially where some of the gaps were with that information as well. They also looked at the forces of change to see what main factors were impacting their community and what that would do to the overall health status of the community. This is kind of just to give you an idea of what they actually saw with that. The top concerns that they identified through their assessment process and through their collective community forums and work groups was a lack of exercise, poor eating habits, being overweight, drug use, alcohol abuse, and unsafe sex. And when you look at that across all 3 counties, they pretty much identified the same top concerns for each of those areas. The main health issues that were identified through the assessment process included obesity, diabetes, and high blood pressure, as well as they also identified limited access to affordable health care, limited access to fresh fruits and vegetables, and limited access to safe places to be physically active. They had a lot of conversation around this piece because in looking at the 3 counties that were served, they're very rural areas, and when they were talking about access to fruits and vegetables, there are a lot of farmers in the areas and a lot of opportunity for folks to access, although it was still identified as a problem because the connection had really not been made between the resources that were there and then how they could make them more available to the community. And the same was identified with physical activity and some of the issues and barriers that were included there around those health pieces. The forces impacting the community, local culture. Very difficult to change a lot of the traditions that had been in place. So they looked at that and had discussion about how they would really, how that's going to impact what they're putting together. Limited resources. In those rural areas, a lot of times the resources are limited and they're very stovepipe, so they're focused on something specific, and being able to have the flexibility to address other issues was part of their discussion. Transportation is always a concern in rural areas, and how they'll have transportation to access the services and products that they need. Healthcare costs was a big component of that because a lot of the assessment work is driven by the hospital and those providers, and so they were really looking at the impact of the health components of the community and what that does to driving up the cost of the services at the local level. And then lack of trust in the system. Unfortunately, there is a history in the community that many times opportunities, grants, resources, programs will come into the community, but then they disappear. So it has created kind of a lack of trust over time, and people are a little bit hesitant to participate or be engaged in certain activities. The Tri-County Health Network really wanted to begin to answer the question, how do we encourage healthy lifestyles? How do we promote a sense of community? How do we ensure access to care and provide a safe environment? They began to look at a collective way to determine their strategic issues. So they used the toolkit to really identify the strategic issue. Why is this an issue? What is the feasibility of addressing this issue? and what is the impact? They took a look at those. During the partner meetings, they had about 28 participants in a community work group, and they began to identify their key issues to begin to kind of shape and frame what those priorities would be. They looked at obesity and chronic conditions, heart disease, stroke, high blood pressure, cancer, and kidney disease, access to healthy foods and safe places to be active, and community conditions around education, employment, income, and poverty. Next, they really began to summarize the critical topics and craft strategic issues. The detail is really in looking at the strategic issue and how it's developed with information and input from the planning team and the work group. So they really began to work to craft their strategic issues, and they came up with how to create and sustain a community-wide partnership that focuses on healthy lifestyles and improving access to care, really building infrastructure. The next one they looked at is how can we ensure and increase access to healthy foods and safe places to be active, and how can we facilitate healthy consumer decision-making to build health skills and knowledge. Thinking evaluation. That is one of the things that the group really struggled with, because you need to be thinking about it throughout the process, because it can be difficult to go back and try to include things. So one of the things that they really kept reminding themselves is why do we need to look at that, because it provides connection between the community strategic plan and how improvements will be made. It also provides details on how strategies can help reach goals and how goals can help address the strategic issues and really set the stage for the next step in measuring the objectives and monitoring and reporting the progress.
All right. We're going to pause here real quick to move over to our poll questions. So if you haven't already answered the poll, please do so now. The question is, what questions must be asked when going through the action cycle? Pick all that apply. So we'll give everyone just another minute in case you haven't. I see. Well, we're going to go down, and first I'm going to say how everyone answered, then we're going to say which questions were, or which answers were actually correct. So first we have, why is this issue picked? About 85% people said that. When do we want to see results? And about 39% chose that. How can we implement this in our community? We had about 62% response. What is the feasibility of addressing this issue? It was about 70%. What is the impact of addressing or not addressing this issue? That was also about 70% of you said that. And 8% said, is this issue controversial? And the answers for that actually were just three of them. It was, why is this issue picked? What is the feasibility of addressing this issue? And what is the impact of addressing or not addressing this issue? Barbara, would you like to comment on that?
Sure. We were really just, to look at the issue and the feasibility of that was part of the big discussion that was included with the group working through their activities.
Okay, and we will continue on.
The next piece really looks at developing objectives and establishing accountability. Used the assessment results to develop realistic and measurable objectives related to each strategic goal. Establish accountability and identify responsibility for each one. Develop action plans aimed at achieving the outcome, objectives, and addressing the selected strategies. Accountability can be really hard because a few will step up to own things, and then others you will need to engage and make them a part of the process so that they can have a long-term role. Now let's take a look at the SMART Objectives checklist and the key components that are included in that, and that is a tool that we used from the toolkit to kind of help guide the discussion with our objective planning. The partners used the SMART Objective template to help them frame their objectives. Sometimes partners think in more general terms, and it really helped them to be specific about what they really wanted to do and by when. The next piece just kind of gives you a breakdown of that template. The group worked through each specific one to kind of look at how and why, and they realized they could not do everything. It was really good to provoke some discussion within the group as they were writing the objectives. It really helped them to narrow their focus and be more specific. And you have just an example of a SMART objective. Remember, this happened over a 6-month time frame. They had multiple meetings with the community work groups to develop their action plan. It took time to get buy-in from partners and for people to be able to take ownership of the components of the plan. They held regular meetings to gather input, and they were trying to be realistic about what they could do within that time frame. They looked at really creating roles and responsibilities and expectations as they moved through the process. The Tri-County Network has really been involved with reviewing those plans, and they're still working on defining some of the roles and responsibilities and expectations. That's one neat thing about the action cycle. It's a continuous loop. So as you go through, a lot of times you will revisit pieces and then look to make sure that you are really achieving what you have set out to do. And that's kind of where they are now. They've been looking at some of the initial work put together. They've been looking at the way that they'll shape that and how those roles and responsibilities will play out in actually implementing and carrying out the activities outlined. All right, next we were looking at a local example that actually came from the Tri-County Network. And that local example shows their strategic issue. What they were looking at was to sustain a community-wide partnership that focuses on healthy lifestyles and improving access to care. The why was really building the infrastructure to focus on healthy lifestyles, improving access, with a goal to expand reach by creating a formal partner network to build capacity and focus on healthy lifestyles and improve outcomes. A big part of what they were looking at in the development of their action plan was really how to structure and strengthen the partner network that was in existence for that Tri-County area. And one of the things that they really wanted to work on was establishing a formal network and shaping it so that it could support the work that they wanted to put forth through the plan. And so by June of 2017, the partners want to actively develop a Tri-County network that is addressing obesity, diabetes, and high blood pressure. And what they're currently doing is trying to identify current partners. They're going to be hosting a community forum to engage other partners and pieces to share the information that they put together so far that they've collected through the assessment process, and then the initial draft of the plan that they have so that they can engage other partners into discussion, get the right people to the table, and begin to really form and shape what they want that plan to look like. And the steering committee has kind of taken the lead with that and has the general ownership of pulling together the work group and taking the next steps.
All right. Thank you. And we're going to pause here real quick to move over to the chat boxes. So the first one is describe a time when you have used SMART objectives and they did or did not work. What happened? So if everyone, all of our participants, want to go ahead and write your answers into that one. We also have a separate chat box, the one below it, that asks, what are some other names for SMART objectives that you may have heard before? So if you want to go ahead, we'll give everyone just a minute or two. All right, and while everyone continues to write in the boxes, I'm going to go ahead and start reading the first one. So again, describe a time when you have used SMART objectives and they did or did not work. What happened? So Gopa said, in my master's program in Public Health 702 course, when I used pre-seed proceed models to develop health intervention, I used SMART objectives. Holly said, I used SMART objectives with performance reviews for my team, and it really worked. She also said, I used them when writing a grant, even though they may not follow through with them in the actual implementation. And Ronnie also commented, like Gopa, when I used the pre-seed proceed model. And then in terms of some other names for SMART objectives, Holly said setting realistic milestones. And Tremaine said the people I've worked with have usually first get together the resources they need, or they knew they need, location, money, volunteers, and then start looking at what needs to be done. It is less of a SMART goals and more of a we need X, Y, and Z, who's doing this. And Lavonda said PDSA. Okay, and I think if I'm mistaken, I think it's Plan, Do, Study, Act. And Lavonda, if I'm wrong, please feel free to comment. Thank you. That's right. All right, and Lavonda also commented about describing a time when she uses SMART objectives, that the medical case managers in HIV program uses SMART objectives to work with patients. The objectives are helpful to help patients reach their goals of changing their lifestyles. And Liz said, Task Force for Decreasing Obesity. They work great to get everyone on the same page. We developed them together. Excellent. Great job, everyone. And it looks as though no one else is typing, so I guess we'll go ahead to the next slide. Barbara, did you want to comment on any of these before we move on?
No, I think the group had great input, and it's one of the things, too, that with working with our local community group, they don't use the term SMART objective either, so it was kind of a learning experience then for really to look at how to apply that, because you had multiple partners from different settings. So I think that it was very effective in using that approach because it allowed them to really learn how to be specific about what they were looking at within the plan. And then that just kind of leads into the next slide that's also included with the worksheet or the evaluation measures. And to be truthful, the group struggled with this piece because I think this was the biggest challenge to them, was really looking at how are we going to measure what we're doing and how are we going to know if we've had success. So when they looked at it, they decided to kind of break it up by year because they wanted to see some early wins and feel encouraged, and they also wanted to see change. And that is something that they're still working on. I know in our last discussion, they've been looking at some of the measures that they came up with, and they're like, okay, we really need to revisit these because with more discussion and more input from partners, especially from various backgrounds, they've really learned a lot about how the hospital measure certain pieces, and then looking at the health department or looking at the YMCA or one of the local schools or church group. And so they're trying to come up with some common measures and things that will apply for all and will help them achieve and look at what they're doing over time. So the big question, if you are really kind of part of the group, and this is what they have asked themselves over and over, is have they really been able to answer the why, the what, and the how, and are their evaluation measures appropriate? So this is something that they apply at each meeting. They really kind of go back and look at things and ask themselves, have we really addressed the why, going all the way back to what they learned through the assessment process, what they learned through the multiple groups, work groups that they've had in the community, and then really looking at what it is or why it is, and then how are we going to be able to implement strategies and have an impact on that, and then what do the measures look like for that. And remember to engage everyone in the evaluation process. I think one of the interesting things is whenever evaluation comes up, a lot of the folks that participate in the work group suddenly become very quiet at the table. And so we really had to kind of go through a different process to get folks to engage in it and share what their thoughts were and really help us answer some of the questions. So they came up with kind of the 4 questions that they have asked over and over through the process. What have we done? How well have we done it? How much have you done it? And how effective have you been? And so that's kind of their check-in to look at where they are in the process and then help them to see where gaps are and where corrections need to be made and do that, and then begin to move forward and try it and repeat the cycle again. Kind of putting it all together, just looking at the planning piece to determine what will be done, who will do it, and how it will be done. The implementation is carrying out those activities identified, and then the evaluation is really determining what has been accomplished and how successful you have been at doing that. And I think the neat thing that we have learned through the action cycle, it is one of the most difficult pieces, and knowing that it repeats itself really helps sustain that method, and then you can go back and make corrections and grow in the process. And I think that's been really crucial for the Tri-County area because they've been looking at that. They've been in that planning mode, and they've been developing their action plan. and they're ready to really begin to shape the work groups. But the first thing that they said was, hey, when we get the bigger group together and the people around the table, we really need to start the process over and take them through looking at the plan and then look at what kind of revisions or changes we could do to make it better, look at who will really be responsible for implementing those pieces, and then how we can effectively evaluate. So that's where they are right now. They are looking at taking the plan out into the community and getting larger groups together, perhaps kind of targeting with some of the partners that are there to link in with local coalitions or groups that are working on similar initiatives and begin to see how they can shape activities into one comprehensive plan so that they can work collectively to address the issues and pull the resources together. One of the neat examples that kind of came out of that through the assessment process, we remembered that access to healthy foods was an issue. And there was a farmer's market there at the Family Health Center, which is the federally funded clinic. And as part of that process with the partners around the table and working through the plan, they began to have dialogue with each other, and they realized very quickly that they could expand the partner network that supports the farmer's market, including Eat Smart, Move More, the hospital, and some other local farmers, looking at some of the church groups and work sites, and doing a better job in linking those partners in and improving, really promoting and improving the use of the farmers market. So that was one of the key things that they kind of focused in on. The hospital also has a community garden, and they looked at linkage with the garden to the farmers market and some of the efforts that they have going on. So it was really a neat process to see things to come alive through the discussion and dialogue that took place through the action planning cycle. And this just kind of gives you the resource if you want to look at the full assessment report. It is available on the hospital's website, and it also has their strategic plan is included there, and then some of the work that's starting with the action plan as well. Some of the next steps, like I mentioned, they are really in the process now of forming their work groups to look at specific activities and determine who will be responsible for each activity, and then really shaping their evaluation and monitoring activities.
Great. Thank you, Barbara. So we're going to, again, pause here to go over to our poll. So the poll asks, what area do you struggle with the most in, quote, the real world? If you could get assistance on any of these, what would it be? Planning, implementation, evaluation, or no vote? So we're going to give you a couple of minutes to cast your vote there. And in the meantime, I'm going to go down to the bottom chat box. And we've been asked if everyone could share with each other your favorite resources, references, or websites that you use to assist you with planning, implementation, and evaluation. And as it states there, we will send this to you in an email once everyone's commented at the end, and we can send this out with the recording as well. And just a reminder that additional resources are listed also underneath Barbara's presentation. She's happened to refer to this one, especially the HSCI toolkit in her presentation. And so if you click there, you can actually open that on your own computer as well. And the supplemental guide for the toolkit is also listed as well. So in terms of some of these resources, Holly has shared the Kellogg Foundation's logic model. We see the collective impact forum is there. Tremaine has commented, I use technology of participation, also known as TOP, methods for summer learning program that she volunteered last year and loved it. They were empowered because their input directed the reports, and now they have user-friendly information that they are now using to implement the changes on their own for this summer's program. Excellent. Shana is also sharing MyACE, which is a community of practice. I get this wrong every week. Tishla has said Integrated Care Resource Center, as well as Center for Healthcare Strategies, the SCAN Foundation, AARP Public Policy Institute. Polly said Survey Monkey is wonderful for surveys. And Janet has commented, the community toolbox is a gold standard for community participation. participation. Excellent. Thank you, everyone. There were some great resources. And so for our poll responses, what area do you struggle with most in the real world? No one said, or 0% really for planning, so that's great. Implementation, we have about 43%, and evaluation is at 67%. So it looks like at least half of you are struggling with evaluation. So, Barbara, do you want to comment on any of these, or maybe share some of your favorite resources?
I think a lot of my favorite resources are listed, and folks that they're using a lot of the same ones that we have. SurveyMonkey was one of the tools that we used with the assessment process and was very successful. I'm looking at the poll results, though, and just thinking how true, because evaluation has really been the hardest piece for the community and all, and they're always looking for resources and ways to better understand kind of how they need to measure their activities. And one of the things that they struggled with through the action cycle was that they wanted to do so much. I mean, you know, they wanted to fix the entire community, and they have really struggled with drilling down and being specific about what is realistic to do and how can you accomplish that. And it's been a difficult process to get those things into a plan and on paper in a sense, because it's kind of trying to figure out, you know, who's going to own what and how it can look. And there's so many issues there within the community, and they really just kind of feel like, okay, what do we tackle first? So I think this whole process has been really great for them because it's helped them to define and look at what is realistic to start with, where they can begin to have an impact, have some simple wins, and in knowing that this process repeats itself, because I think initially when they started, they thought, okay, I have to create this plan and this is it, and it has to look this way forever. And I think when they got into it and they began to realize, you know what, we can go back and we can change parts of our plan, we can make it come alive, and if things aren't working, we can take that out or reframe it. So I think that has been, to me, one of the most valuable takeaways from this whole process. And when they said they wanted to take it out and kind of start it over in the community and continue to get input and continue to grow and shape it, I thought, okay, now they really, you know, are ready to take those next steps. They're really looking at how they're going to move it to implementation and to maintain it and help it grow over time.
Thank you very much, Barbara. And thank you again for joining us today. We appreciate you taking the time to share all these wonderful experiences and these resources that are going to be very helpful to us and others as they work in their communities. So thank you, and to thank you for all our participants for joining today. I would also like to thank our technical assistance team, Holly Hayes, Grant Jackson, and Lydia Frass for today's webinar. So does anyone have any questions for Barbara? You can go ahead and unmute your phone with *6, or you can go ahead and raise your hand. All right. I don't hear any questions. So as we wrap up, if everyone could please provide your feedback in the chat boxes. It's very helpful for us in developing these webinars, so we really appreciate that. So for all you enrolled in our community engagement course, and for those that took the time out of your schedule to join us, we hope you found today to be just engaging and informative. We will be posting the recordings of these webinars to our virtual campus, so you can have access to these at any time. They'll also be posted in the course shell for those of you taking the course again. So if you have any questions concerning anything about our continuing education community engagement courses, please do not hesitate to contact me. You can also find out more about these through MySPH.org. So again, thank you very much for joining. Feel free to continue to provide your feedback in the chat boxes.
And we really want some input on future webinar topics as we develop more content. We're interested in knowing what specific topics you would be really interested in as your journey through public health.
And if there's no more questions, we thank you all. Thanks, Barbara.
Thank you, everyone.